Good evening, students. Today we'll be discussing about trigeminal nerve. So it is the largest of all cranial nerves. Sensory root approximately contains 1,70,000 fibers and motor root approximately contains 7,700 fibers. Emerges from ventral surface of pons at its junction with middle cerebellar peduncle. Motor root lies ventromedial to the sensory root at the point of emergence. Sensory root is attached to the concave posteromedial margin of the trigeminal ganglia, which is situated in an impression above the apex of petrous temporal at the floor of middle cranial fossa. So this trigeminal ganglia is located in the Meckel's cave, which is in relation to the apex of the petrous temporal. You can see here, this is the apex of the petrous temporal. This is the Meckel's cave or cavum trigeminal, where trigeminal ganglia is present. You can see the trigeminal nerve emerging from the ventral surface of pons and passing forward from posterior to middle cranial fossa, reaches the trigeminal ganglion. This is the sensory root and this is the motor root. Only the sensory root is directly connected to the trigeminal ganglion, whereas the motor root passes below it. You can see here from the convex margin of the trigeminal ganglion, there are three branches which are arising. So this is the ophthalmic nerve, which passes in relation to the lateral wall of cavernous sinus and then divides into three branches, namely the lacrimal nerve. Then you can see the frontal nerve and you can see the nasociliary nerve. You can see the nasociliary is passing through the common tendinous ring, whereas frontal and lacrimal are passing through the lateral compartment of superior orbital fissure. So then you can see this is the second branch, the maxillary nerve. Again, this is also passing in relation to the lateral wall of the cavernous sinus, passes through foramen rotundum, through pterygopalatine fossa, then inferior orbital fissure. From here onwards, it is called as intraorbital nerve, which passes in the intraorbital canal and groove and emerges to intraorbital foramen and forms the infraorbital plexus. And you can see this is the mandibular division, which goes downwards through foramen ovale along with the motor root, and immediately below the foramen ovale, both the roots will join to form the trunk of the mandibular nerve, which will divide into anterior and posterior division. So this is the overview of trigeminal nerve. Let us go with the further details. As you see, the trigeminal ganglion contains cell bodies of pseudo-unipolar first sensory neurons. So it lodges in the pouch of dura mater called cavum trigeminal. So this pseudo-unipolar first sensory neurons, these are almost similar to the dorsal root ganglia of the spinal nerves. So the convex anterolateral margin of the trigeminal ganglion gives attachment to three divisions of the trigeminal nerve, namely ophthalmic, maxillary and mandibular. So these are the respective approximate number of fibers through these divisions. If you observe this number of fibers, you see the smallest of the three divisions is the ophthalmic and the largest of the three divisions is the mandibular. So functional components. So within the sensory root, so it has general exteroceptive sensation fibers. The cell bodies are located in trigeminal ganglion. They carry the sensations from face, scalp as far as vertex, teeth, mucosa of gums, oral and nasal cavities with paranasal sinuses, cornea, conjunctiva and dura mater. So general proprioceptive sensation, cell bodies are located in the mesencephalic nucleus of midbrain. So this is the most important point. The first order sensory neurons located within the central nervous system is this mesencephalic nucleus. That means the pseudo-unipolar neurons located within the central nervous system is just the mesencephalic nucleus of the trigeminal nerve. So muscles of mastication, extraocular muscles and muscles of facial expression, all these muscles proprioception is carried to the mesencephalic nucleus. Then the motor root is having fibers of brachiomotor fibers to muscles developed from first arch, namely the muscles of mastication, tensor tympani, tensor palatini, mylohyoid and anterobelly of digastric. So nucleus related to the trigeminal nerve are the mesencephalic nucleus, which is located in the midbrain, concerned with proprioception; principal sensory nucleus, which is located in the pons, concerned with the discriminative touch; spinal nucleus of trigeminal nerve, which extends from caudal end of principal sensory nucleus to the second or third cervical segments. So below this level, it is continuous with the substantia gelatinosa. So there are three parts of the spinal nucleus of trigeminal nerve: pars oralis, which receives touch fibers from mouth; pars interpolaris, which receives nociceptive fibers from teeth; pars caudalis, which receives pain and temperature sensations from all trigeminal areas. In addition to this, it also receives afferents from skin via C2 and C3 and also from dura mater. It also receives general somatic fibers from facial, glossopharyngeal, and vagus nerves. So motor nucleus located in the pons, special visceral efferent, supplies muscles of the first branchial arch. So you can see here, this is a mesencephalic nucleus. Within the midbrain is the principal sensory nucleus of trigeminal nerve within the pons, and this is the spinal nucleus of the trigeminal nerve. See, it is extending into the upper cervical segments. And you can see here, so this is the motor nucleus of the trigeminal nerve. So intracranial course. So after its emergence from the ventral surface of pons, it passes forward from posterior cranial fossa to the cavum trigeminal of the middle cranial fossa below tentorium cerebelli. So sensory root joins with the posterior margin of trigeminal ganglion. At pons, motor root lies ventromedial to sensory root, but as it passes forward, undergoes spiral course and lies below sensory root and trigeminal ganglion at cavum trigeminal. Motor root turns downward to join with the sensory component of mandibular nerve after passing through foramen ovale to form mandibular nerve trunk. So convex anterior margin of the trigeminal ganglion gives attachment to three divisions, the ophthalmic, maxillary and mandibular nerves. The ophthalmic nerve runs forward in lateral wall of cavernous sinus, enters orbit through superior orbital fissure by dividing into three branches, namely the nasociliary, frontal and lacrimal. It supplies cornea, conjunctiva, upper eyelid, forehead, anterior part of scalp and the nose. The maxillary nerve runs forward in lateral wall of cavernous sinus to the foramen rotundum, then enters pterygopalatine fossa, then passes through inferior orbital fissure, floor of orbit, and emerges through infraorbital foramen on the face. So maxillary nerve area of supply: skin of cheek, lateral aspect of nose, upper lip, upper teeth, and maxilla. By its connections with pterygopalatine ganglion, it supplies mucous membrane of nasal cavity, palate, and nasopharynx. Mandibular nerve, sensory root passes downward from trigeminal ganglion, enters foramen ovale. Below foramen ovale joins with motor root to form trunk of the mandibular nerve. So mandibular nerve area of supply. So the sensory is to the skin of the lower lip, chin, part of the cheek and temple, lower teeth and anterior two-thirds of the tongue. And the motor fibers supply the muscles of mastication, tensor tympani, tensor avella palatini, mylohyoid and anterobili digastric. You can see here, this is the area of distribution of the three divisions of the trigeminal nerve. You can see here this V1 represents the area of distribution of the ophthalmic nerve, V3 represents the area of distribution of the maxillary nerve, and V2 represents the area of distribution of the mandibular nerve. So almost entire face and almost the scalp, forehead, all these are supplied with the trigeminal nerve except a small area of skin in relation to the angle of mandible which is supplied by the great auricular nerve. So parasympathetic ganglia associated with the trigeminal nerve are ciliary ganglion, which is connected to nasociliary nerve, which is a branch from ophthalmic nerve. Otic ganglia, so which is connected to nerve to medial pterygoid, which is a branch of mandibular nerve. Submandibular ganglion connected to lingual nerve, which is a branch of mandibular nerve. Pterygopalatine ganglion, which is connected to maxillary nerve. So all these ganglia are topographically related to one of the divisions of the trigeminal nerve, but functionally they are connected to other nerves. You can see here, this is the location of the ciliary ganglion in the orbit. You can see the location of pterygopalatine ganglion in the pterygopalatine fossa. You can see the location of otic ganglion in the infratemporal fossa, and you can see the submandibular ganglion in submandibular region. Trigeminal ganglion, also called as semilunar ganglion or gasserian ganglion. It is a sensory ganglion, corresponds with dorsal root gangliospinal nerves, contains cell bodies of pseudounipolar first sensory neurons. Location in an impression above the apex of pedis temporal at the floor of middle cranial fossa. So outside posterior part of lateral wall of cavernous sinus. It's almost 5 centimeters deep to the preauricular point. You can see here, this is the cavum trigeminal and this is the trigeminal ganglion. These are the three divisions of the trigeminal nerve: ophthalmic, maxillary and mandibular, and you can see this is the motor root. And if you observe properly, anteriorly these meninges are adhering to the epineurium here, whereas posteriorly the sensory root and motor root are having surrounded by subarachnoid space. CSF is being present around these two roots, but anteriorly, so this dura are attached to the epineurium. So shape is semilunar. So convex margin is directed anterolaterally. Coverings, it contained in the Meckel's cave or cavum trigeminal, which is a dural pouch. So roof of the cave is formed by two meningeal layers, whereas floor of the cave is formed by one meningeal layer and one endosteal layer. So why this difference? Because it is formed by billowing of meningeal layer from posterior cranial fossa to the middle cranial fossa. So mouth of the cave is directed behind, transmits motor and sensory root of the trigeminal nerve. You can see here, this is the mouth of the cavum trigeminal, which is transmitting the sensory root and motor root. You can see this is the meningeal layer which is projecting into the medial cranial fossa from posterior cranial fossa. So that is why root is having the two meningeal layers, whereas floor is having meningeal and endosteal layer. So mouth of the cave bounded above by superior petrosal sinus, below by trigeminal notch at the upper margin of petrous temporal, just lateral to its apex. So cavum contains namely the trigeminal ganglion and its sensory and motor roots. So dura and arachnoid are adherent to the epineurium of trigeminal ganglion and its three divisions. The posterior part of the ganglion, its sensory and motor roots are surrounded by the pia arachnoid and are bathed in the cerebrospinal fluid. So relations of the ganglion. So below it is the motor root of fifth nerve, as it was evident from the earlier diagram. Then greater petrosal nerve, apex of the petrous temporal and foramen lacerum. So above, free margin of the tentorium cerebelli and superior petrosal sinus. Medially, posterior part of the lateral wall of cavernous sinus, internal carotid artery surrounded by plexus of sympathetic nerves. Laterally, uncus of temporal lobe, middle meningeal vessels and nervus spinosus. So trigeminal ganglion communications, it communicates with the sympathetic plexus around internal carotid artery, and it also gives meningeal twigs to tentorium cerebelli and floor of the middle cranial fossa. So branches, peripheral branches emerge from convex margin of the ganglion. So they form three divisions, the ophthalmic, maxillary and mandibular nerves. So central branches attached to concave margin of the ganglion, sensory root of the trigeminal nerve, attached to the anterior surface of the pons at its junction with middle cerebellar peduncle. So 50% of the fibers divide into ascending and descending branches, and remaining fibers ascend and descend without division. Ascending branches are thick fibers, goes to principal sensory nucleus, which are concerned with discriminative touch. Few fibers goes to mesencephalic nucleus, which are concerned with proprioception. You can see here, the majority of the fibers are dividing into ascending and descending, and you can see here a fiber directly passing without any division. Then descending branches, thin myelinated fibers and unmyelinated fibers forms spinal tract of trigeminal nerve, which accompanies the lateral side of spinal nucleus of trigeminal nerve, which carries pain, temperature and light touch from trigeminal area. So central connections, second order neurons reach the ventral posteromedial nucleus of thalamus. If the fibers are crossed, it is called ventral trigeminal thalamic tract, forms from primary sensory nucleus and spinal nucleus of trigeminal nerve. Uncrossed fibers, dorsal trigeminal thalamic tract, few fibers from principal sensory nucleus. So third order neurons from thalamus terminate in lower part of the postcentral gyrus and evoke consciousness. So collaterals from trigeminal thalamic tract will go to reticular nuclei and are helpful in arousal response. So this can be explained by this example: sprinkling water on face of patients with fainting attacks helps in regaining consciousness. You can see here. So this is spinal nucleus, principal sensory nucleus, and mesencephalic nucleus. So from all this, you can see the second order neurons going to the ventral posteromedial nucleus, and from there you can see the third order neurons going to the postcentral gyrus. So arterial supply through the ganglionic branches of the internal carotid artery, middle meningeal artery and accessory meningeal vessels. So these three vessels are in surrounding relation to the trigeminal ganglion. So then the applied aspects, trigeminal neuralgia, otherwise called as tic douloureux, which is the intractable facial pain. So how it is characterized? It is characterized by paroxysms of pain along distribution of trigeminal nerve with periods of remission and exacerbation. So pain will be sudden in onset with mild stimulation of the face. You can see ophthalmic, maxillary, mandibular divisions. Even mild touch can stimulate the pain. So treatment, medical treatment includes prescription of carbamazepine, which is an anticonvulsive agent. So if medical treatment fails, so then alcohol or phenol in myodil may be injected in the trigeminal ganglion through foramen ovale. So when ophthalmic nerve is not involved, surgical resection of inferior lateral part of the sensory root interrupts maxillary and mandibular fibers. If ophthalmic division only affected, then elective section of the spinal tract of trigeminal nerve at tuberculum cinereum, which is in the lateral part of medulla, so 4 or 5 millimeters deep below the obex is preferred. So these are surgical options. This is a medical option. So few more medical options are available, and there are more numerous clinical conditions in relation to the lesion of the trigeminal ganglion, which are beyond the purview of this session. Thank you.